The world of today may have changed, but we'll never stop doing good. So the youth can reach their dreams. So women can give more light to their families. So that all Filipinos can move forward, leaving no one behind. We make today better because today is what shapes the future. And in the future, we see everyone leading a lifetime for good. InLife, a lifetime for good. The world of today may have changed, but we'll never stop doing good. So the youth can reach their dreams. So women can give more light to their families. So that all Filipinos can move forward, leaving no one behind. We make today better because today is what shapes the future. And in the future, we see everyone leading a lifetime for good. InLife, a lifetime for good.
Good morning, everyone, and welcome to another special edition of BusinessWorld Insights. My name is Danny Laurel, your host and moderator for this discussion entitled Protecting Health and Wealth, Managing Medical Bills in Critical Situations. Now, the world currently grapples with health and economic crises due to COVID-19, which then stressed the need to protect our health and finances. But given these very uncertain times, how can we assure that our finances would keep up with all of these healthcare needs? And guys, where can we find financial support to manage and recover from all of these health issues that are, of course, costing us more than the medical bills? Now, today we are joined by experts from the healthcare and finance sectors who will help us to better understand how we can protect our health and also our wealth within these challenging times. Now, for our audience, thank you so much for joining us. We will be taking some of your questions for the speakers later. So start jotting down those questions and do share with us your questions. You can type that in the comment box below and we will make sure to get through all of them. Now, without further ado, let us welcome our first speaker. Dr. Marie Antoinette Y. Remonte is a medical doctor who specializes in internal medicine and pulmonology. She is currently the acting manager of the Benefits Development and Research Department of the Philippine Health Insurance Corporation. Doctora, you have the screen.
Good morning, everyone. Managing medical bills in a critical situation. Indeed, getting serious illness is one of the major health shocks that a family or individuals can have. It affects the productivity and income of the individuals or household because a member of the household cannot work. And then the family or the household must deal with the medical expenses and medical treatment, including hospitalization. The increased infectiousness of COVID 19 worsens the situation. Imagine a member getting sick will lead to the entire member of the household getting quarantined inside the house for at least 2 weeks. That's the best scenario. The worst scenario would be all of them or most of them will get sick and hospitalized. So, a way to protect ourselves, our households against these health shocks like COVID-19 pandemic is to prepare ourselves even before these events happen. The Universal Healthcare Act recognized that health services must be financed through prepayment mechanisms, including social health insurance, private health insurance, and HMOs. The government, through the National Health Insurance Program, which PhilHealth administer, aims to protect Filipinos against these health shocks. So it's a prepayment scheme by collecting premium contributions of those who have the capacity to pay and subsidizing those who cannot pay. The monies are pulled together under one fund, the Social Health Insurance Fund, and this is our source when we get health shocks like the COVID 19 pandemic. Over.
Thank you so much, Dr. Remonte. We will get back to all of those statements just in a while. But next up, we have Ms. Noemi Azura. Ms. Azura is the President and CEO of Insular Healthcare, the HMO subsidiary of Insular Life. She's also the Senior Executive Vice President as well as Head of Digital Insurance and Program Director of InLife Sheroes at Insular Life Assurance Company Limited. Now, prior to InLife, Ms. Azura had a long career in banking, having held senior leadership roles at Citibank, American Express, and Australia New Zealand Bank. She is currently a member of the board of Citi Savings Bank. Now, in 2016, Ms. Azura was awarded the Icons of Healthcare Singapore Award for Female Healthcare Professional of the Year Award by Berg Singapore in recognition of her work in providing new age digital healthcare access to Filipinos. Ms. Azura, your turn to give your opening remarks.
Hi, thank you, Danny, and good morning to everyone. Well, many leaders view the pandemic as a health, humanitarian, and economic crisis. The InLife Group has responded to this crisis with humanitarian initiatives like donation of PPEs to healthcare workers, extension of financial assistance to our agents, and distribution of food packs to communities adversely impacted by the lockdowns. InLife also provided financial coverage that's authentic to our core business, which is free insurance for essential workers that included life insurance plus hospital income for accidents or COVID 19 cases. And in addition, for the benefit of our clients, both Insular Life and its HMO subsidiary, InLife Healthcare, provided ex gratia coverage for COVID 19 claims despite exclusions of pandemic diseases in some of our insurance contracts. This difficult period puts to test a brand's character, and we are proud to take our place in history because through these many initiatives, we have proven that the InLife brand is a reliable brand in good and in bad times. But let me also share about the positive developments that happened during the pandemic. The market research conducted by Nielsen and SGB Ernst& Young showed encouraging insights on changes in consumer behavior. First, health and staying healthy has become the consumer's top priority. Second, the experience of pandemic has generated significant interest in protection products, especially among the younger population below the age of 44. They are looking for short-term protection plans to cover hospital bills, credit card bills, lost income, mortgage payments, and education costs. And third, the pandemic permanently changed the consumer behavior. They prefer digital channels in interacting with agents and with insurers. Fourth, consumers prefer insurance brands with social responsibility and empathy. And this is a consideration in their buying decisions. Insurance companies and HMOs must prepare to respond to these permanent changes in consumer behavior. The InLife Group is uniquely positioned to respond to these shifts in consumer behavior. We have both life insurance, InLife, and an HMO subsidiary, InLife Healthcare. Together, the InLife Group adopts a holistic approach to help clients manage their health and financial risks. First, we have a wide range of products and price points that cover a client's health protection needs and budget. We have products for individuals and families, for small businesses and large corporations. And some of these products cover COVID 19. And second, we serve our clients through expert financial advisors and through digital channels. It's the client's calls on how they want to interact with us through people channels with our competent financial advisors or through our 24/7 convenient digital channels. And third, we promote financial literacy and health and well being among our clients. Our intention is to help our customers make informed financial decisions, which include financial risk management. And in addition, we want to help our clients remain in good health through our healthy living and disease prevention education. Knowledge is an important enabler in health and financial risk management. We need to live with the threat of infectious diseases like COVID 19. And as we restart the economy, individuals, families, and businesses must recognize and address the continuing health and financial risks that can adversely impact our economic recovery. This is where the insurance companies and HMOs can help.
Thank you so much, Ms. Noemi, for those opening remarks. And completing our panel today, we have with us Vincent Lau. Mr. Lau is the co-founder and chief executive officer at Maria Health. This is a tech startup that operates as the first licensed health insurance only aggregator with a vision to solve the $20 billion underinsurance gap. Mr. Lau has over 10 years of diverse experience from consulting for Fortune 500 companies at Accenture to product management roles in growth stage startups in Silicon Valley. Now, prior to Maria Health, he recently worked with the largest ad agencies and consumer brands at an ad technology startup funded by Netscape founder Jim Clark. Vincent, the floor is yours.
Hi, everyone. It's a pleasure to be here today. Thank you, Insular, Business World, and sponsors for having us. It's an honor to be around such esteemed leaders. As one of the co-founders of Maria Health, we started the company to solve a big problem. Little did we know we would be at the forefront of COVID and how important health insurance is for the country. With over 100 million Filipinos with only 2% access to health insurance, we're inspired as a small company to use technology and design to ensure anyone who wants access to health insurance can do so. Over the past few years, we served over 2 million Filipinos globally. We've insured over 30,000 members and growing, from SMEs looking for health insurance with COVID coverage for their employees to individuals and family through our services. But of course, we still have a long way to go. We've grown from a business that initially was focused on just helping SMEs and their insurance needs to expanding our services to anyone who wants health insurance in the Philippines. I still remember when we launched our first version of Maria Health, while we were advertising to small business owners, people in the Philippines didn't care. They still responded to our small business ads because they needed help. So it's these countless stories we're all accustomed of hearing, catastrophic health scares that can wipe out a family's savings, and how unfortunate these situations are and how they can all be prevented. These are stories that inspire us and myself at Maria Health and ultimately why we exist. We recognize that in the COVID world that we live in today, health insurance has become more important, and coupled with the high existing out-of-pocket expenses, how important financial security and health insurance is to the needs of the country. But ultimately, I believe we're not alone in this journey, and we look forward to continuing to work alongside stakeholders from insurers, regulators, and government to accelerate access to health insurance that is inclusive for everyone in the Philippines.
Thank you, Vincent, for that statement. Now let's move forward to the panel discussion and welcome back our speakers on screen. So stay on the screen, Vincent, but also again joining us, of course, Dr. Remonte and Miss Naomi Azura. Hello, ladies and gentlemen. Okay, let's kick off with a very, very big question. It seems to be something that we already know is a difficult question, but something that needs more nuance here. Let's kick off with Dr. Remonte, of course, working for the Philippine Health Insurance Corporation. Hospital bills. This has been a struggle. COVID, no COVID, it is something that most people, not even many people, most people cannot afford here in the Philippines. How bad was the situation already pre-pandemic, and how did the pandemic worsen this even?
Um, Pre-pandemic, we have I think about 30 to 40 support value of the total hospitalization bills. But during the pandemic, there is also increase in the cost of care uh, because of the use of other innovation or technologies. So we are still getting our data as to our support value. So, but we really saw the increase in the actual hospitalization charges. And to address that, PhilHealth all implemented benefit packages that is much, much more than what we were offering pre-pandemic for COVID-19.
All right, thank you for that. Miss Noemi, do you want to maybe jump in on this? How much of, I don't know, a person's monthly income was normally spent on healthcare before the pandemic, and has this percentage maybe changed? Has that been, significant?
Yeah, what we have observed is that, as I shared in my opening statement, no, there is a growing interest in health and wellness, and also in healthcare coverage. But what made the situation worse during the pandemic compared to before the pandemic? But what made the situation worse during this pandemic? I would agree with Dr. Rimonte. No? Number one, there are three major factors. So first would be medical inflation, and
Okay.
second would be job losses, and third, business closure. So these were the three factors that some of the factors that made the situation worse. I think I read from your publication, according to Mercer Marsh Benefits, 2020 medical cost in the Philippines had an average increase of 10.1% compared to 9.3% in 2019. And this outpaced the general inflation by 6 times. So if medical costs in the Philippines continue to outstrip inflation, this is unsustainable in the long term. And the cost of care increased because of diagnostic tests and also cost of medical care for COVID-19 cases. This is due to higher professional fees, additional costs like protective equipment or PPEs, and also the RT-PCR testing. But in terms of job losses and reduced working days due to intermittent lockdowns resulted also in the weaker purchasing power for the consumers. In 2020, for example, about 4.5 million Filipinos have lost their jobs, and the unemployment rate in 2020 was at 10.4%, which is the highest in
Mhm.
15 years. For 2021, according to the Philippine Statistics Authority, we have seen some improvement. The unemployment rate went down to 6.9% in July, but still, this is equivalent to 3 million people. And but this is the lowest since the corona virus pandemic began. But there's also the case of underemployment, or the rate of or percentage of working population looking for more work because their present job cannot make their ends meet. And this stands at 20.9% in July, equivalent to 8.6 million people. In a paper published by ADB this September, in the financial sector by the financial sector specialist Shigehiro Shinozaki, it showed that 70.6% of micro, small, and medium enterprises in the Philippines were forced to temporarily close due to the COVID-19 outbreak. So these were the three factors that really
Okay.
made the pandemic situation worse.
Okay, thank you for that. I think you really nuanced it. Vincent, maybe jumping off on that point, can people still afford insurance now? You know, of course, now being the time that you should be tapping into insurance, but as mentioned by Noemi, this is the time where we don't have employment, and you know, as such, we need to cut from the budget. Of course, we don't want to cut the insurance from the budget, but what have you been observing when it comes to insurance coverage as part of the budget?
Yeah, so great question, Danny. And I'd say, for Maria Health, as a technology company, as a marketplace, we capture a lot of data on our customers, their profiles. And, what we are seeing is that we conducted a survey over the past several months. And what we essentially asked was, what is your kind of monthly income? How much have you budgeted towards, annual medical expenses? And what's interesting is that the average budget that folks are allocating to health insurance is about 3.5%, right? Now, as you start to get to the kind of lower income groups, that percentage actually goes up. So, for example, if you're making 10,000 pesos per month, it's 7%. Right? If you're making from 10 to 20,000, it's about still around 7%. So when you look at kind of the annual expected medical expenses, that represents about 7% of your monthly income. So, and I'd say what is very kind of hopeful and exciting is that, for 8,000 to 12,000 pesos in medical expenses, you can actually go and purchase a health insurance plan that would essentially kind of cap your potential kind of medical expenses for the same amount of out-of-pocket costs as well.
Okay, so interestingly, the lower, if I understood correctly, lower income bracket is spending more as a percentage of their income. Doctora, is this something that the government is addressing, or are you trying to create some adjustments? You already mentioned PhilHealth coverage will be covering more things, so that we don't burden the lowest income classes in having to, of course, spend their well earned money, and of course, they have lower income now because of pandemic, on healthcare. And will the government be providing more coverage specifically for COVID-19 treatments?
Insurance
Doctora?
program.
Okay.
The premium contribution for the National Health Insurance Program range from 300 pesos a month up to 1,800 for higher income group. So this is only about, as mandated by law, 3% of the salary. And based on the income and expenditure survey, we spend combined with with clothes, shoes, and tobacco and alcohol about 3.5%. So this is for this amount that we spend to other things. Those who can have the capacity to pay can contribute to the National Health Insurance Program. But as to the poor, those who have no income or very low income that is not, or that is even below the mandated income floor or salary floor, the government has a program. It subsidizes actually the premium contribution of these indigents, what we call under the indigency program, for their enrollment to the National Health Insurance Program. As to the benefit packages, the expansion of our benefits is connected to the amount of the health insurance fund that we have. But because of the Universal Health Care Act, we are mandated to expand, focusing on the outpatient benefit packages and primary care. So we will be addressing the prevention aspect as well as the outpatient. For COVID, we already introduced you. We already covered the testing packages. Before, we do not cover outpatient testing. This is a start for COVID. Then we have other benefits for COVID like isolation and home isolation, which previously we do not. Most of our packages or benefits are focused on inpatient and hospitalization.
Okay, so for the same amount po of premiums, hopefully more coverage will be happening, at least from the government side. Miss Noemi, what about from the private sector side? Of course, the insurances did not have all of this COVID-19 testing, isolation in the coverage, and people are now scrambling to understand, will I be covered? Will I need to be paying more in my current insurance policy? Even personally for myself, diba, I really don't know what coverage will there be. Are you expanding these products with no extra cost, or how were you managing this?
Okay, first, a number of our existing life insurance products already cover deaths and hospital allowances. That includes COVID-19, so not so much change in this respect. Second, in our contracts where pandemic diseases are excluded, InLife Group covered COVID-19 ex gratia. However, this ex gratia coverage is not sustainable in the long term. So as COVID becomes endemic and as we gain experience in COVID-19 incidents, we should be able to predict and price in the COVID-19 risks in the insurance contracts. Actually, we have a wide range of products and price points for the different needs of our clients. And I'd like to share three of our affordable protection products because there seem to be misconception that insurance products are only for the middle class or for the wealthy people and that they're not affordable. So that's not true. And I would like to share three of our affordable protection products that help people manage their health and financial risks. So first, from InLife Healthcare, which is the HMO subsidiary of InLife, the best-selling product now is the affordable prepaid emergency care product. So the cost is only 1,750 pesos and
Mhm.
it gives you the coverage for 1 year up to 100,000 pesos coverage for emergency cases due to accidents, viral, and bacterial infections. And it covers COVID-19 ex
Okay.
gratia. So you can purchase them at the InLife Healthcare website and also at Maria Health and in Lazada. Second, we launched a new product from Insular Life for other serious diseases and also COVID. So the name of the product is Prime Secure Light. So the premium depends on age, but it is as low as 2,500, 18 to it's for 18 to 47 years old, and the benefit is up to 750,000 in total. So it provides for the following: up to 150,000 lump sum cash upon diagnosis of CHAS, which is the acronym for cancer, heart attack, or stroke. And these are the three leading causes of mortality in the Philippines. And up to 300,000 life insurance benefit in case of death, up to 150,000 additional insurance benefit is the if the cause of death is due to COVID, and up to 150,000 extended accident insurance coverage for the spouse. So imagine for only 2,500 pesos, you can get a benefit up to 750,000 in total. And these are also available at our inlifestore.com.ph online store.
Thank you, Miss Noemi. Very interesting options there. And like you mentioned, insurance is for all. If anything, it should be for the most vulnerable, diba? It's not supposed to be for the rich people. Vincent, speaking of that, how has your platform, evolved during the pandemic? Obviously, it was best positioned. Your entire onus for, was digitalization of insurance to begin with, even before this entire thing turned us into technology freaks. So, how has technology made the process easier? Do you see that precisely because of the pandemic, more people have been comparing health insurance uh, products online? Ms. Noemi mentioned you can even buy now, in Lazada, anywhere. So, how is this evolved?
Yeah, great question again, Danny. I'd say, how things have evolved with Maria Health is, obviously we've seen a huge influx in demand for insurance. Just to kind of quantify, how much kind of the demand has strengthened. We've seen kind of over 200% increases in what we kind of quantify as kind of stronger demand for health insurance. I'd say from a technology standpoint, not much has changed. We've been, primarily focused on, how do we take technology along with design to make health insurance accessible. And, I'd say Maria Health was founded with this vision to make it easier, whether you're SME or individual, to be able to shop and compare the best policies. I'd say where we are shifting our focus and where technology comes to play is, given that there is such a stronger demand, we've obviously been able to see that in our business. Where we are continuing to double down on technology is continue to build more tools um, for our team to be able to service this influx, right? So most of our customers will come to us and they want to know what policies are available for them. What's the price? They want a proposal. And so for us, it's continue to double on technology so that we can answer the questions of those who need health insurance the most. And ultimately, technology will enable us to, service billions globally.
Thank you for that. So not just a platform for comparing different policies, but even as you mentioned, customer service, being closer to the client's needs and being able to really tailor fit what is needed in these times, especially with the budget. And speaking of the budget, let's move on to financial literacy and how to budget all of these issues. Doctora, how do you advise people to save during these emergency times? How can they allot amounts for health and other with all of the other costs and of course the lower income that they are experiencing?
For us, because it's there is a law, it's a mandatory, so it's for working, it's automatically deducted from the salary. But as I will always say, the minimum contribution in the National Health Insurance Fund is only 300 per month, and that's what you spend uh, in Starbucks for a coffee and a sandwich. So contribution to the National Health Insurance Fund is only a small amount of what you earn. But if you going to need it in the future, for instance, for COVID, you will get automatic coverage. So for instance, imagine for a contribution of 300 a month, if the patient will have severe COVID, he or she will have a coverage of 786,000 for the hospitalization. So the benefit outweighs the risk, no, or the amount that they pay. So it's has been recognized that prepayment mechanism is the way to shield us from these health shocks, from including the COVID-19.
Okay, and
Over.
very basic points here that just starting with the government healthcare part, diba? You're already at least protected at the minimum. Miss Noemi, what about the fact that we there are a lot of things not under the control of the patient. For instance, the hospital ICU beds, the amount of even the public hospitals, or if we are insured in a private hospital but that might be full, that might not accommodate us. How do we manage that with our insurance provider? How can we handle unexpected medical bills that were not necessarily under our control?
Okay, I would like to provide a holistic answer to this question, no, and not just limit my response to emergency funds. So, in answering this question, a major consideration is the life stage. The financial needs of people change over time depending on their life stage. So, young adulthood, building a family, middle age, also this is the career peak, and retirement. So, I can give recommendations for the Gens Z and Y because they make up 70% of the population. So their life stages would be young adult and building a family. So my first major recommendation is to learn about personal finance or money management so that you can be smart with money. I think Danny, you touched on this earlier. And in money management, there are four focus areas. Number one, expenses. Two, debt. Three, protection. And then savings and investments. So let's start with expenses. You need to track your expenses. You may have a big appetite for life, but you may have limited earnings at this point. So it's important for you to plan and track your expenses. And the plan should include setting aside regular savings. You can download an app like Wallet or Dollar Bird to help you track your expenses. And the second focus area would be debt. So be careful with getting into debt, especially overusing your credit cards. These are expensive ways to borrow. But on the other hand, if you are married and in your 30s, it may be time to consider getting a mortgage for your family home. Third, protection. This is where insurance comes in. Insurance is a risk management tool in building your wealth. So pass on your financial risks to insurers. And here's how. First is protect yourself. So get an affordable emergency coverage like what I have mentioned earlier. InLife Healthcare's prepaid emergency care for only 1,750. You're covered for 100,000 pesos emergency cases due to accidents, viral and bacterial infections, including COVID. Second is protect your family. So if you are caring for your children or other family members, you also need to get affordable emergency care coverage for them. And in addition, you almost certainly need life insurance to provide for their needs if you suddenly die. And depending on your circumstances, you may also need a more comprehensive health and disability insurance to provide income and help pay for medical expenses. The fourth focus area is savings and investments. If you are single and a young adult, build an emergency fund of between 3 to 6 months based on your monthly living expenses. If you have young children, you can start with 3 to 6 months based on your monthly living expenses, but you need to make an assessment. You may need a bigger emergency fund depending on your circumstances, because at this point, you will also need to start saving for their education. And well, as a practical suggestion, you can look for savings accounts with embedded insurance. So you can check out Union Bank's Savings Plus. It comes with embedded insurance from InLife. And if you have a Savings Plus account for a minimum maintaining balance of 25,000 for new customers between ages 18 to 60 years old, you can avail of the following embedded insurance benefits on the Savings Plus account from Union Bank. So life insurance, accidental death and disability benefit, burial benefit, and terminal illness benefit.
Thank you, Miss Noemi. Vincent, can we ask you, she already mentioned very interesting on how to break down, let's say, your expenses, right? And depending on your life stage. But let's focus on health insurance and what you should be looking at when you are going into your portal or even just in general, shopping around for different health insurance providers. What is more important now? Of course, we want the best coverage. If we had all the money in the world, we would have the best possible coverage that we can, afford. But right now, how do we make the most out of it to be able to save and cut on our expenses, but still have this peace of mind that we did what we could.
Yeah, I'd say the most important thing when looking for the right health insurance plan, depending on the life stage, is we actually did another survey, and I'd say when you ask people in the Philippines, what is the most important factor, it's actually coverage and benefits, right? Coverage and benefits actually it's 3 times greater than brand or price. So I'd say the most important thing when you're going to Maria Health or any other kind of platform is to kind of really understand what's covered in the policy, right? Health insurance is by nature confusing. It's typically not written in sort of plain English. So at Maria Health, what we've done and continue to do with technology is how do we make sure that we use technology and design to ensure that if someone in the Philippines is looking for health insurance and they want to compare between different HMO brands or insurers, right, we can empower those looking for health insurance to be able to easily compare side by side. So things that you should be looking for are, again, this is all dependent on kind of life stage, and every customer is diverse and unique in its own way. But I think top questions that we hear from our customers is pre-existing coverage covered, right? Is COVID covered, right? What are kind of the maximum benefit limits. Is it a maximum benefit limit? Is it an aggregate benefit limit? These are kind of very drastic and different kind of coverages. So inside Maria Health, that's where we're adding value to the conversation, which is we don't. Not only do we make health insurance accessible by ensuring that anyone, as long as they have access to a phone, they can access the services and the help of Maria Health. But more importantly, as an aggregator, our stance is to make comparison shopping easy. We're unbiased, and ultimately, we want to make this information as easy as possible, so the customer can find the right policy for them and their loved ones.
Okay, thanks, Fonsan. So basically, do not scrimp on insurance. Do not just base it on what's popular, or like you mentioned, of course, the brand is important, but nevertheless, it's really the coverage and not just the price, but really like what is really written. And like you mentioned, hopefully these things would be more transparent, more easily understood by the consumer, and something that's easily comparable across different companies. Okay, guys, at this point, I'm going to be taking some audience questions here. I have one first of all, and let's read this out loud, and then let's see who wants to answer this. This pandemic has exposed gaps and shortcomings in our healthcare system in general. And moving forward after COVID, what sustainable policies have to be made, both in the public and private sector? I think, Dr. Remonte, this goes to you. Shortcomings exposed, what needs to be done?
We saw the lack of hospital beds, the lack of ICU, the lack of oxygen equipment, in the lack of access to tertiary care in island provinces where there are no high level 3 hospitals. So we have to upgrade our hospitals, and we have to make sure that every area or every island in the Philippines should have an access to tertiary care, to ICUs, because it will save lives. Then, as to health insurance, to PhilHealth, we have to adapt to technology. I'm listening very well to Mr. Vincent Lau here, as he discussed, the technology in getting health insurance. So why not PhilHealth? Develop a PhilHealth app for a national health insurance program. Then we have to see how can we cover other service delivery models. We are so focused on hospitals, but we see that management of COVID doesn't happen only in hospitals. We also see that right now telemedicine is the way, to limit the exposure of the doctors, and also for easier access of our clients. So we have to look into that, study that further. Then also within PhilHealth, we have to make changes so that we could faster adapt, to the ever-changing situation, because it's not as if it's not business as usual. There's what they call a VUCA world. It's already unpredictable. There's uncertainty and even ambiguity. So we have to adjust our policy into that.
Thank you, ma'am. Just to follow up on that, Doctora, what technology has PhilHealth adopted here for, maybe is there an app that we can understand our contributions? What are you working on? And Vincent, maybe you can add on later on. How do you hope that gets embedded in the Maria Healthcare platform?
Before our enrollment, or the enrollment, the updating of membership has to go. The person has to go directly to a PhilHealth office. So now we have a member portal, but we have to enhance that. Before we cannot. The payment has to go to the banks and accredited collecting agents. So I think right now, at least, we are adopting online payments already. So those those things we are just starting.
Okay, good to know, ma'am. Vincent, sorry, could you come off of mute, please?
Oh, okay. I was just unmuted. So I guess the question is, how do we continue to kind of use technology to make getting insurance easier and faster, and where are areas of opportunity? So
And
for
maybe
us,
just relate it with the Phil Health.
oh
Do
yeah,
you have options for the government service providers as well in Maria Health?
yeah. So yeah, absolutely would love to work with PhilHealth to make the process of enrolling and applying to PhilHealth much easier. I'd say where that parallels to where I'd say from an InsurTech perspective, Maria Health, where we can kind of improve the process. And I'd say that today, as Dr. mentioned, is that you know once you are ready to find the right policy, right, the whole application, the whole enrollment process, payments is still something that happens kind of in the offline world, right? And I'd say the kind of downstream impact to that is that when you have so many people looking for health insurance, and for the insurers, obviously we're all working from home, and people can't kind of operate face to face. Yeah, I'd say that the kind of resulting impact is that it just takes much longer for people to get health insurance. So if you think about the process today, when people are ready to apply to a health insurance plan, forms are still predominantly filled out with pen and paper. What if this was all online through Maria Health? Applications are reviewed by people who have to then encode, these applications. And then you have another 17, 14 days to kind of process. And so what if we can build technology to help make the validation, the underwriting, and the approval process, transition from weeks to minutes? And then the last point is something that we've, some of the challenge we've been going through as well is, given that Maria Health is, a direct-to-consumer brand, we interact with the customer, we help facilitate the process, we help them with the kind of enrollment process. But when it comes time to payment, right, they still have to go, offline to make a payment. So when you start to add these pieces from application form to payment to getting your policy, in our experience, it still takes over 30 days for someone that is ready to buy insurance to actually get their policy. So I believe that the biggest kind of areas of improvements is how do we kind of streamline that process, and ultimately, I think by moving this process online, what we'll be able to capture is a tremendous amount of data, and I think what will kind of further improve the outcomes in pricing, underwriting risk and margins, and ultimately getting more folks insured is what if we can use data about applicants, their profiles, their segments, to fundamentally improve product and pricing, so that we can service the diverse needs of our customers that come to Maria Health. So say these are the kind of areas that we are investing heavily at Maria Health. And so, yeah, that's where we feel the opportunity is.
Mr. Amy, can you jump in? Why does it take this long nga naman? It is true what he says. There are a lot of paper forms. You want to be insured, you want to pay right away, but then it gets back to you after 30 days. You don't know when the coverage begins. How can we now? We have the technology to do it. We are clicking and buying things online. Why can't we have insurance right away?
Okay, so thank you for that question because I agree with you. It's a major pain point for customers, no? In purchasing and availing of health insurance. And we recognize these pain points, and that's why digitalization is a major enabler of the both the InLife and also the InLife healthcare businesses. So first of all, the affordable insurance coverage, the emergency care, these are already available online. So the purchase journey is very convenient. And then upon checkout, so they can check all the products available online. And upon checkout, there's also a wide option for payment. So they can pay with credit cards. They can also pay with I think more than 18 online channels who are partners of Dragon Pay. So GCash, some of our members, no, a few of them even pay with Bitcoin. So that's how wide the payment options are, because this is exactly a pain point that we have addressed. So earlier it was also mentioned, no, that there's a lot of legalese and insurance contracts, and it may be hard for consumers or our clients to understand. So that has been addressed also. We have simplified the terms and conditions so that they know exactly what are covered and what are not covered. So I think some of the HMO businesses and insurance companies like ours in the InLife group, we have responded to this pain point, and it has been welcomed by the market, and that's why we are seeing phenomenal growth, especially in our affordable emergency care line.
Okay, thank you for that. So a lot of the, I think what you both mentioned was the payments was really a bottleneck here, diba? You can do it online, but then you have to pay in the bank physically. All right, I have another question here from the floor. I think this one, Dr. Remonte, you can try to answer this. As a private sector employee, already with a PhilHealth plan and an HMO provided by the company, is it still advisable to purchase a personal HMO or insurance plan, or should we feel comfortable already if we are contributing to PhilHealth? Can you come off of mute, ma'am, please? Thank you.
There is a room, no, for HMO or private health insurance because, as I said, PhilHealth is focused on inpatient care. There are other services that we are not yet covering, so like emergency services, and then so many outpatient services. So yes, it is still advisable to have a personal insurance, no, if to prepare yourself for the as this is for future needs. And then the Universal Healthcare Act actually recognized the role of private health insurance and HMO to complement the the PhilHealth in providing health insurance or in financing care in general over.
Vincent, could you maybe add, if you already are covered by your company, is this mutually exclusive towards a person having to add a personal HMO?
Well, I would say that if you're covered by your employee, we haven't seen use cases where, if a employee is covered by the company, we haven't seen them need to purchase an additional kind of HMO plan. Now, I'd say that there are options out in the market where if you want additional coverage, additional benefits, additional limits, in addition to what is provided by your employer, we do have products and services that can essentially allow you to top up. So again, I think health insurance is obviously different for every kind of individual or family, but there are options out there, and yeah, Maria Health can help in those situations.
Okay, and precisely why you are able to Maria Health give add-ons, right, and not just have one shop, one type of box for all. Vincent, while I have you there's another question for you because you've been talking a lot about the data, right? That we are using, that you're using to be able to understand the needs of clients better. But how is the data privacy ensured in a digital healthcare environment right now?
Yeah, so I'd say first answer to that question is number one, we do comply with the national kind of data privacy laws of the Philippines. We have checks and balances in terms of who can own certain types of data, who has certain privileges to certain types of data, and also from a kind of technology infrastructure perspective, we encrypt certain types of information, we redact certain type of information that is considered kind of personally identifiable information. So we take data privacy very seriously, particularly given that we deal with kind of real people and kind of medical related information. Yeah, we are extremely, we take this very seriously, and working closely with our insurers and partners to ensure the right protocols in place so that everyone's data is protected.
Thank you for that. And I think, if you would allow me one last question for Miss Noemi, I'm very, very interested to know, from a personal perspective, because I've been covering the news a lot on vaccination. How does this all feed in to health insurance? Is there, some sort of incentive for being vaccinated, especially in COVID, when it comes to the policies that are being taken out, it is, does it make it in some sense cheaper? Does it make us safer? Is there something that you are already looking into?
Yes, of course. We have encouraged we very much promote prevention, no? Healthy living and disease prevention. And part of the disease prevention is to encourage our clients to get, like, for example, flu shots. And we assist our clients in the administration of flu shots. So we connect them to supplier, a pharma supplier, and also we assist in the administration to their employees. So definitely, vaccination is a form of important prevention for the population. But for
Excellent.
COVID-19, yeah, for COVID-19 vaccinations, I think this is a bigger undertaking because it requires tripartite agreements, right? Between the government, the pharmaceutical, and also the employers. So this is handled differently.
Okay, but as you mentioned, it's part of the prevention as well that you advise any person to be doing at this point in time, and hopefully, of course, prevents the medical bills in these critical situations to be piling up. Thank you so much. I think it's time to close this session with some final words for our audience. I would like to give the floor to Vincent Lau for your closing remarks, followed by Ms. Azura and then Dr. Bautista.
Yeah,
Sorry,
again,
Dr.
all right. Thank you for having me. It's a pleasure to be, again, sharing the floor with such esteemed leaders. Obviously, with COVID, it's a big concern. It's hit home. It's real. Please check us out at mariahealth.ph. If there are any questions, we're here to help.
Great. Thank you, Vincent. Ms. Noemi?
Okay, insurance products are risk management tools to help protect you and your family from financial losses in the event of death, sickness, or disability. So it is important for you to learn and familiarize yourselves with the workings of insurance and understand what kind of protection is best for you and your family amid this pandemic and beyond, and in your different life stages.
Thank you, Ms. Noemi Azura. And finally, Dr. Mary Antoinette Remonte.
Thank you for having me here. Payment for health during sickness is more expensive and even catastrophic. The Universal Healthcare Act recognized that health services should be financed through prepayment schemes. The National Health Insurance Program is a social health insurance program of the government that finances health services through prepayment mechanism. So it's a mandatory scheme. All Filipinos will be enrolled and automatically eligible for the benefits. The contribution are based on the capacity to pay, while the access to benefits are based on the health needs. Thank you.
Thank you so much. So thank you again to our speakers, Dr. Mary Antoinette Remonte. We've got Ms. Noemi Azura and, of course, Mr. Vincent Lau. And much gratitude to InLife for making this session possible. And, of course, to our supporting organizations. We have the British Chamber of Commerce of the Philippines, the Management Association of the Philippines, the Philippine Chamber of Commerce and Industry, and, of course, our media partner, the Philippine STAR. And to everyone who joined today's discussion, thank you so much. Please join us again in the next sessions of Business World Insights, and be sure to follow Business World online to be updated on our next projects. This is Danny Laurel, and this has been Business World Insights. Stay safe and healthy, and have a good afternoon.
The world of today may have changed, but we'll never stop doing good. So the youth can reach their dreams. So women can give more light to their families. So that all Filipinos can move forward, leaving no one behind. We make today better because today is what shapes the future. And in the future, we see everyone leading a lifetime for good. InLife, a lifetime for good. The world of today may have changed, but we'll never stop doing good. So the youth can reach their dreams. So women can give more light to their families. So that all Filipinos can move forward, leaving no one behind. We make today better because today is what shapes the future. And in the future, we see everyone leading a lifetime for good. InLife, a lifetime for good.